Now, they say that the eyes are the windows to the soul, but they're also something of a window into your health as well. An expert can tell an awful lot about what's going on in your body just by looking into your eyes. Dr. Salvador is with us today, consultant ophthalmologist at Barraquer Eye Hospital, to answer my questions and yours, and already questions coming in on eye health today. Doctor, how are you today?
Doing well, thank you. How are you?
I'm well. Now, I always find it really interesting in terms of the health topics that we get lots of messages on. I get kind of tuned into it. So I'll tell you, we got loads of messages about skin, like dermatologists, loads of questions about feet and teeth, and many about eyes as well. And I have a couple of kind of theories about it. And I think if we have something going on in our body, if it's gastro or headache, we might just go and see our family doctor. But when it comes to a specialist, we're never really sure if we can just go straight to see a doctor such as yourself, or if we need a referral. So this is why I love the show when we do a clinic like this, because people can get straight to the expert just by picking up their phone. So as I said, we've had some questions for you, sir. So tell us a little bit about what you see coming into clinic there as an ophthalmologist. What are some of the issues that you're working with?
Here in Dubai, mostly dry eye because of the weather conditions, also the lifestyle that we're following lately with all the screen time that we spend many, many hours in front of the screens, the phones, computers,
Yeah, I saw a tweet the other day which is like, I had a lovely day looking at my screen, now I'm going to come home and look at another screen while looking at a small screen.
Exactly. So we don't take breaks from the screens, and basically every time that you are looking at the screen, you don't blink that frequently.
Okay.
So the eyes get exposed, they get dry, and if you add that to the weather conditions, the dust, the heat, everything, which are drying conditions, that affects your eyes. And we see a lot of patients with dry
So
eye
what
problems.
are some of the kind of complaints that people come in with dry eye that people might... And you know what? We just get used to living in a certain way of discomfort and in pain and think, okay, this is just what my body does now. So with dry eye, what are people coming in? What symptoms are they displaying?
Mostly, they have foreign body sensation. They tell you, oh, I have like something in my eye.
Something. Okay.
They can become red. They can become itchy. Itchiness can also be associated with allergies, for example. And it's very frequent here to find people who rub their eyes because of that, instead of using artificial tears or other types of drops that could help, and that can trigger other problems in the eyes that could make your vision get worse, or maybe you need some surgeries because of the rubbing. So
it's that serious? Yeah. Interesting. Okay, so with dry eye, you're talking there about artificial tears, so drops. Is that just a management, or is that actually going to treat the problem and ultimately cure it?
You need to treat the problem. So mild dry eye, maybe... you may feel better only with some artificial tears, but sometimes it's also related to some systemic problems. The whole body is affected, let's say, okay? Some autoimmune diseases, your own defenses attacking your body can cause dry eye. Having, for example, low levels of thyroid hormone can cause dry eye.
Really?
Yeah. So our goal or our duty as an eye doctor, as a specialist, is to try to find what is the cause so we can treat the root of the problem.
Tell us about the 20-20-20 rule, because this is something that comes up time and time again, and I'm always intrigued. Although a friend did tell me apparently you work for 20 minutes and then you go and live in the woods for 20 years. And I was like, that sounds amazing. Let's do that.
I wish, but no. No, it's basically we recommend to take breaks from the screens. And there's this 20-20-20 rule, which means every 20 minutes you should look for 20 seconds further than 20 feet away. Okay.
And is this for the eye muscle, or what's it for?
No, it's basically it's basically for the dryness and also for the fatigue. So we are working 8-10 hours in front of a computer. At the end of the day, it's very common to have blurry vision, to have even headaches, or to feel like the eyes are heavy.
Yes.
And this is because I usually tell my patients, this is like going to the gym and lifting weights. No, you are lifting 2 kilos all day. At the end of the day, your muscles are sore. You can even lift 1 kilo maybe.
So it's the equivalent of lactic acid of the eyes.
Yeah, you could say that.
A message here from Julie saying, do you find because of the screens, children are presenting earlier with eye issues?
Yeah. There's a trend in myopia, basically short-sighted, is getting bigger and bigger in children. And this is because they spend less time outdoors, they spend more time in front of a computer, and that basically triggers the eyes to become more short-sighted.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis, or treatment.
It's your eye clinic on the show this afternoon. Chance to get some free advice from Dr. Salvador, consultant ophthalmologist at Barraquer Eye Hospital, talking about how some signs and symptoms that we might just get used to seeing or experiencing could be an indication of something perhaps a bit more serious going on in the body. Drooping eyelids, and we're not talking about as we get a little bit older and might need to go and see a different kind of doctor. When it comes to an eye issue that you might see, what can that be an indication of?
Well, first of all, even the droopy eyelid that relates to age should be taken care by us. Okay.
Well, that's actually a friend of mine had this recently. She had some, I'm sorry to the squeamish, she had about 1 centimetre of skin removed from her eyelid. Mm-hmm. And she said exactly that she's really glad that she went to an eye specialist rather than a general plastic surgeon, because you don't want to mess with your vision.
No. I mean, plastic surgeons are great. They do lots of great stuff. But when it comes to the eyes, I would rather have my eyelids done by an oculoplastics rather than by a plastic surgeon.
Thank you for saying that word, because I would never been able to pronounce it or indeed find it. So if we're not talking about necessarily aesthetics and aging, but drooping eyelids, what do you mean by that, and what can it be a sign of?
It depends on the age of the patient. For example, here we see lots of children with droopy eyelid, and in their case, it needs to be addressed, because if it blocks the visual axis, it can lead to lazy eye, for example.
Okay.
And sometimes they need surgery, not only for the aesthetic reasons, but also for the vision reasons. And but if the patient is older, you have to look into whether they have any other like systemic diseases, like it could be myasthenia gravis, it could be some problems with the nerves that or problems with the muscles. Okay. So it could be maybe sometimes it could be related to multiple sclerosis or other diseases. So if it's something that wasn't there before, or was there but it's getting worse, you should always have it looked.
Let's do a little quick fire round with some things that you might see coming into clinic. What if you have a ring around your cornea? What can that be an indication of?
This is it's very common, actually. I mean, as we age, more people get it. It's called gerontoxin or arcus senilis, which means an old arc or old ring, let's say. Okay. And usually it's deposits of cholesterol or fatty acids
in the eye.
Yeah.
Whoa.
And it's very typical with age. However, if you find it in young people, in a young person, 20-year-old or something, you should look into the cholesterol levels, because it
check.
Yeah.
What about the yellow whites of the eyes? And we see this actually, probably more commonly than we'd like to. What can that point to?
Usually, liver. I mean, the people who have problems with liver, let's say like a cancer or like alcoholism or things that can affect the liver, can turn the scleras yellow. And
is that reversible then if you address the root cause?
Usually, I mean, kind of like, it depends on how long it's been there. The yellowish kind of like color doesn't go away completely. But the most important thing is to treat whatever is causing that.
Do you ever find yourself meeting someone in real life, at a dinner, or you get introduced to someone and you're like, oh, I really am desperate to have a little chat to you about what I'm seeing in your eyes?
Yeah, lots of times.
Really?
I mean,
and do you?
Yeah. And sometimes they just offer. They say, okay, I have this, and so what do you think? And I say, okay, yeah, I've noticed, blah blah.
It's like my friend's a dentist, and he's like, can we just have a night off of asking me to look in someone's mouth, please? Same with a podiatrist friend as well. She's like, I can't help myself. I walk behind people and I'm just desperate to go and talk to them. Let's go to the text line. A message here saying, I'm a 64-year-old female. For about a year and a half, been finding it difficult to focus looking forward after glancing left or right, but will succeed if I look far and then close at front. Myopic at 4 and 4.25, which is the right eye. Ophthalmologist found my eyes in perfect health. Optician too. What could it be? What comes to mind there? That's from Lena.
I mean, first we would need to fully assess the eyes, obviously. I mean, if it's a problem with focusing, sometimes even though she's 64, there's a little bit of a remnant of that ability to focus. The ability to focus, we lose it by the age of 42 to 45. But some people still have some degree of that ability, let's say. If it's something that if she sees double, if she sees two images separated, then we need to look into the movement of the eyes, because it could be strabismus, it could be what we usually call squint. Okay. Some strabismus, some squint doesn't show up all the time. It only shows up when we look for it or when we trigger it. Okay. And if she finds it difficult when she looks to the side and then to the front, I would probably start by looking at that.
And what kind of doctor would you need to go and see for that? Could you go, is an ophthalmologist that Lena's already been to see, or is there anyone who's more specialised in that specific problem? She said knowing nothing at all.
So usually, even though the eye is very small,
well, this is what I mean.
We divide it in many, many parts, because it's actually I call it like a big small wall, let's say, okay? So for example, I'm specialised in the front part of the eye. But I have colleagues who specialize in the retina, which is the back part of the eye. I have colleagues who specialize in strabismus, in the movement of the eyes, or neuroophthalmology, oculoplastics, we've mentioned that before, glaucoma, the high pressure in the eye. So I would recommend...
Yeah. Okay. A message here saying, "Hi doctor, will myopia go away for children? I'm having a guilt inside me that I'm the reason why my child has to use spectacles at minus 2.75. My husband has the same guilt." He does, which is ridiculous. I'm like, everybody's different. Everything. Will it go away, or is this something that this family just needs to make their peace with? Usually,
myopia, I mean, if both parents are myopes, chances of the children being myopes is very high. I mean, it's like thinking about height, for example. If both parents are 150, chances of you being 2 meters tall are very little.
Thin.
I wouldn't worry too much.
Oh, but let it go. Just let it go. That's a bit of a clue, by the way, for our competition. Seema's saying, can signs of diabetes be spotted in the eye?
Yes, definitely. Especially in the retina. Because diabetes, one of the things that diabetes causes is kind of like small infarcts, let's say, in the microvasculature. And the retina is full of little vessels, and we can see it. And it's one of our routine exams, one of the parts of our routine exam, to check on diabetes, which is highly prevalent in this country.
It certainly is. A message here from Mark saying, I need reading glasses minus 1.5. Am I okay to buy them off the shelf, or do I need to get them made? I have a prescription.
I mean, if it's only 1.5, it's okay to buy them over the counter or on the shelf.
Not a big deal.
If he doesn't have any other issues with the eyes, it's okay. I sometimes recommend my patients to not spend a lot of money in fancy glasses, because those work. They really work.
I'm wearing very cheap over-the-counter glasses right now.
Yeah.
I know,
and they work.
They do, of course.
So.
But here's my question then, because hopefully this will help Mark, who reached out with his initial question. If I feel like my glasses are less effective, do I then just tweak it by a 0.5, or do I need to come back and see an expert?
I would recommend that he has it checked, because there may be a little bit of astigmatism, for example.
Okay.
And those are not in these glasses.
Which leads me to Bilal's question. So finally, how often should we visit an eye doctor as an adult? The only time I do is when I need to renew my driver's license. Yeah, I hear you.
Once a year. Especially after the age of 40.
Oh, that's me. That's why is it always after 40? You've got to tick the higher age bracket box, and then you've got to go to the doctor once a year. Okay. And in that, it's a pretty straightforward check. And unless, of course, you're presenting with anything we've been talking about today, or you've presumably got any kind of predisposition through family issues as well. Number of people asking for your details, which I'm happy to share. Dr. Salvador is there at Barraquer Eye Hospital. Thank you so much for your time today. Really appreciate it. And if you do want doctor's details, just send me the word "I" and I will send you a link happily to you. And of course, the whole team who specialise in, I love that. Did you say it was a big, small world of the eye? I think you're absolutely right. Dr. Salvador, thank you so much. Really appreciate your insights today.
Thank you very much.
And it's been a pleasure.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis or treatment.